Today we're going to be talking about pelvic floor healing after birth. I'm going to be joined with Essentials PT that's going to talk to us about all things pelvic floor related, getting your body ready for birth, getting your body ready after the baby is born, and all things in between. So I'm going to pull her in now to join. Hello, everyone. This live will be saved for everyone, so it will be a permanent spot on my page. But I am going to Essentials PT on. Hello, happy Monday, everyone. Happy Monday. Hey,
Hello.
Nikki. How are you?
Good. How are you, Diana?
I am good. So we have a bunch of people already starting going in.
Great.
I did let everyone know this live. When I go live with people, I know, sometimes people can't catch it. So this live will be a permanent spot on my page for anyone that wants to come back and look. If you have to pop in and out, thank y'all for spending your lunch with us. I wanted to get together with Allie from Essentials PT just to talk about pelvic floor health, pregnancy, birth, beyond, because I am learning how essential it is. Like now that I'm finally getting a chance to get back to me, and I was talking to my stories this morning, I don't want you all out here to make the same mistake that I did, that I had two babies back to back, age 5 and age 3.5, and I'm now just realizing how incredibly horrible my core is. I have like 3 finger separation, because I had 2 kids back to back, full term, back literally. And I am doing exercises and realizing like how things need to improve. So it's so important doing mental health awareness, because it's about our mental health too.
Absolutely.
Like we want to feel good about ourselves. We can't just look good. We got to feel good, be good. And I know, like, in your essence of me following your page, and looking at your stories and being involved, and seeing what you post and how much in testimonials you get back from people, just as much, you know what I'm saying? I love when I see people doing things like me, not like me, like you're not, but when I'm saying truly concerned with maternal health, making sure we have what we need to be successful. I know you're a mom too, so I'm gonna let you tell the audience and your audience, you and I, we can start from there.
Sure. So hello, everybody. If you don't know me, my name's Allie. I own Essentials Physical Therapy. It's myself, Rachel, and Casey are 2 other therapists that work with me, and we really specialize in helping women through all stages of basically birth, whether it's while you're pregnant, prepping for delivery, after pregnancy, and we really focus on, like you said, I consider it is a mental thing, right? If you don't feel like yourself, you feel like you're falling apart, if you feel like you throw a pant every day and that's not your typical, like, you just don't feel good. We help moms get back to feeling like themselves, and especially moms that love to be active. We really like to focus on getting them back to exercise, feeling comfortable and confident, doing the things that they love. And of course, all our kids are going to grow up. They're going to be running, jumping. We don't want anybody to be limited or feel like they can't join in with things with their kids, simply because they're in pain or having other issues with their pelvic floor. We see clients, I'm local to New Jersey, so I'm also on the East Coast. We see clients in South Jersey, but also, and how I started my business was completely virtual, offering what we call pelvic health coaching. And we have clients anywhere from, we have clients in Maryland, California, Pennsylvania, Florida. So we have clients kind of all over the country that we help virtually. And this is something that's always been very near and dear to my heart, because when I had kids and my kids were young, I didn't have help. I couldn't get to an appointment. And we really fill that gap where moms might stay home with multiple kids, or they may not be able to get off work to come in for a visit. We have these options for them where they don't have to worry about childcare. They can just do it from the comfort of their home, and we can help them feel better.
So can we start with the easiest question of all? What is the pelvic floor?
I love this question. Oh, I have a model too, but I think I have it. I should have brought it out. I have it in the closet, not in a good place. So the pelvic floor are all of the muscles, and you can adjust here, all of the muscles that sit inside your pelvis. We call it the pelvic bowl. So when you think about our hips, right, we think about like our butt muscles, maybe our quads and our hamstrings, everything inside our pelvis is technically the pelvic floor. And often it's forgotten about, right? So we're thinking about exercise, or we're thinking about things like sneezing and coughing, or just even having stability in our back, feeling like we're strong. Our pelvic floor muscles are the muscles that are going to give that stability to the pelvis, but from the inside. And then of course, other than giving stability to our body, they help us support our organs like our bladder. They help us go to the bathroom, be continent or be incontinent. And it is, like I said, often the missing link when people are struggling with something. We can't forget about that. It plays such a role.
Got it. So everyone, if you have questions, oh, good. If you have questions, put it in the chat. Anything is not off limits. We won't say any names of your screen names, because this live will be saved for everyone. But if you have questions, like, we have Allie here, like, you know, you can always DM her as well, I'm sure, if you have questions about, you know, her services and stuff, but like, we have her here. So if you have questions, don't be shy. I want to ask a question though. Do you find, or have found in your research, do you find that people, depending on the type of birth they have more or less concerns, or is it all bet? It doesn't matter either way?
I love this question. So, of course, the answer is it depends. Okay. I will say, on a whole, women that have a vaginal birth may have a higher chance of having something called prolapse, which is where the muscles of the pelvic floor are a little bit weakened and stretched out, and we might feel like a heaviness because our organs are sort of sitting a little bit lower. But people that have a C-section can also have those symptoms too. There is no, you know, how we give birth doesn't necessarily translate into what we feel, right? I have women that have C-sections that have issues with pelvic floor pain and tension after they have a baby. And I have women that have a vaginal birth that might have abdominal cramping, even though they didn't have their stomach cut. So I would say it can make the prevalence of those things a little bit higher, but as a whole, I see women on both ends.
So how would you tell someone, and you may have a post on your page somewhere, I would love if you would just share it with me so I can share it with the community. But is there a comprehensive way to tell, like, when signs are present, to know that you may have a concern with your pelvic floor?
Okay, I think you cut off for a second saying, is there anything that really shows, yes, I have a problem with my pelvic floor? You know, I just try to deal with it. Is there a way to identify signs that you do have something going on with the floor? Okay, so some very basic things are obviously, one, are you continent? Can you hold in your pee? Can you hold in your poop? Can you hold in your gas? If you have problems with any of those, which, by the way, everyone talks about leaking urine, but having issues with stool is more common than people think, or having trouble holding gas. Anything like that, right away, we know pelvic floor isn't working at its best. Tension or pain with intimacy, issues keeping a tampon in. This is a big one I hear from women. They're like, I have no issues, but a tampon falls out as soon as I put it in, or I can't wear a tampon for more than an hour, or it's coming out. All of these are indications that your pelvic floor isn't doing what it needs to. Those are the big ones. I will say, oftentimes women that have given birth and then have hip pain or back pain that maybe they didn't have previously, very common for the pelvic floor to be involved in some way with that because of the stability that they provide to that lower part of the body. Wow.
Okay. So I've told my community before, I don't think it's not related to my pelvic floor, but for someone that is like constipation, like, well, you said poop, and we're going to talk about it because we're here and that's fine. I publicly, like, when my cycle comes on, everything slows down. And I mean, everything. Like, I get, you know, everything just slows down and I need help to kind of, you know, everything just slows down. We're not sure we're done with our family planning before we do something more, you know, figure out what the next steps would be with my doctor. But that's where I am. So do you find any ties with cycles, like when that comes back on after birth, anything like that?
Yes. So absolutely, our cycle is going to impact our symptoms. So if you think about it just from a very basic level, right? When you're pregnant, everybody knows we have all these hormones running through our body. We might be a little bit more lax, which means when we're lax, everybody thinks, oh, my muscles are loose. What happens is the muscles get tight because they have more work to do because your ligaments are a little bit looser. So same thing, we're going through our cycle. A lot of people find around the time that they are starting their cycle or just before that their pelvic floor symptoms or things like constipation can really ramp up because we have a little more of those hormones running through our body. And on top of that, we do have a heaviness there because we're about to bleed. So our muscles are working a little bit harder. That can make things like prolapse more prevalent, but also constipation, because our muscles have to work harder. They're going to be a little bit tighter, then it's harder for things to get moving. So absolutely things can be cycle dependent. And when I see clients that are very clearly like, at my cycle I have a problem, every other time I'm okay, usually what I'm saying is a week before you start your cycle, so whatever management strategies I would give, whether it was mobility or whatever, a week before your cycle, no matter what, no matter how you feel, you start with strategies and you're trying to catch it. So that, and keep it until your cycle's done.
No, amazing. We do have a question in the chat. How do I test those muscles? What does a strong pelvic floor look like? That's a good one. And what does a weak pelvic floor look like?
I love this question. So, not to like completely turn things on their head or confuse anybody, but I will say, as a pelvic floor PT of over 4 years, I actually usually do not care about your pelvic floor strength, which people can find very shocking. What I care about the most is your pelvic floor coordination. Cannot tell you how many times, well, people come to see me, my pelvic floor is weak, I have these issues. The real problem is that they're not coordinating well. When the pelvic floor should naturally be contracting, supporting, giving us stability, it's doing the opposite because we're bearing down, or we're not, maybe the muscles are so tight, they're too tired to do that job for us. If we can fix coordination, we usually fix the problem. It is so rare that I actually have to have somebody do Kegels. And when I do have to give Kegels, I'm usually giving, and that's where we're purposefully squeezing the pelvic floor to build strength. When I do give those, I'm usually, again, giving them from the lens of coordination. You're only doing like 30 to make sure you're coordinating well. So an easy way to test yourself, by no means is this, you know, like a very like black and white thing. There's gray area, but an easy way to test yourself is when you breathe in, right? Our lungs fill with air. Our stomach should expand a little bit. If it's not, right there, you know, we've got an issue. If we're just, so our ribs expand, our chest expands, our belly expands. We should, in theory, feel our pelvic floor area expand. And a lot of people will be like, what does that even mean? I'll literally tell people, like, sit on your hand. Like, you want your fingers right at the perineum. When you breathe in, and the perineum is a space between your butthole and your vagina. Hopefully we can say these things. We don't get blocked on Instagram. So you want to feel that area. As you breathe in, do you feel that area expand a little bit into your hand? Or does nothing happen? Or does it pull away? What we want is with the breath in, we feel a little expansion. And with the breath out, that expansion comes back. And we want to do that without needing to do a Kegel. We just want it to be like, I breathe in, everything opens, I breathe out, things close. That's a very basic way to see, am I coordinating well? Then of course we look at things in other positions and movements, but on a basic level, that's what we need to know.
Awesome. So someone said, give me a shout out. Dr. Zeno am I saying your last Zeno?
Yes, yep.
Is the correct. I talked about my pet peeve on names, so I always like to make sure. And then someone else says, Dr. Ali saved my back during and after my pregnancy. Love it. Someone then asked, can I strengthen my pelvic floor while pregnant?
You guys are here with the amazing questions. So yes, and again, so I'm going to change what you're saying a little bit, that we don't want to have the mentality of building strength in the pelvic floor during pregnancy. What we want to be thinking about is, can we maintain our coordination? This is a lot harder than you think. So when we give birth, if we're having a vaginal birth, the pelvic floor muscles need to expand, lengthen, and open. So in this situation, building a lot of strength, being super strong, won't actually help us, because if we can't let go, if we can't bear down, if we can't lengthen, well, that baby's gonna have a hard time coming out. So instead, like I said, our focus should be on coordination, what I just spoke about. Inhale, do things open. Exhale, do things come together. And how can we be in different positions, work on our breathing to maintain that? Because what you're going to find, and I don't know if whoever asked this, I'm not sure how far along you are in your pregnancy, but what you're going to find is that, hopefully people can sort of see, I'm kind of showing my stomach here. As your stomach grows during pregnancy, we lose the ability to take this nice full breath. What ends up happening is we end up doing this. Our stomach's larger, it's pushing up on our diaphragm, which we need to take a great breath, and we end up like this, taking breaths. which is cutting off our coordination to our pelvic floor. So again, we want to focus on that coordination, opening on the inhale, and then things come back together on the exhale versus doing Kegels.
Wow. I love that coordination of not adding additional things to the body and help it. So I think that's amazing. Then someone just asked, does or can pelvic floor affect the regularity of your period?
Oh, I have to be honest, I don't know. I will say I have. The answer is I do not know. I will say I have anecdotal evidence from different clients that clients had a history of a lot of pelvic floor tension, actually have a harder time getting pregnant and having a vaginal delivery, but I'm not sure about the cycle. If you're having issues with regularity, it's probably more of a hormonal kind of a thing, I would think.
So what did you think? Can you say what you did find anecdotally? What was it again? That what?
Sorry, people that have a very tight pelvic floor, history of pain with intimacy, just a lot of tension on those muscles, it might be harder for them to get pregnant and have a vaginal birth.
I love it. Okay, y'all, you're asking some amazing questions. Someone said join late, so sorry if covered. Does poor coordination impact menstrual cup use or comfort? I didn't have issues pre, but postpartum, I noticed it staying low tilting.
Okay, I know what you're asking. So you maybe missed a little bit that I just said issues with tampons.
Asking first to people because I don't. What does that? What is
sure. So some people in here might be familiar with using a menstrual cup, which is a plastic, flexible silicone, goes into the vagina during the period. So just like I mentioned before, some people have issues with tampons. Tampons can't stay in. You feel the tampons. That's an issue of pelvic floor dysfunction. Same thing with using a cup. So this person was asking, is poor coordination related to the cup not being in the right place or feeling tilted? So it could be coordination, but it sounds like if you're putting it in and you put it in and right away you're like, oh, this doesn't feel right, I can't quite get this in the right place. That tells me this might be more of a tension problem. A coordination problem would look more like, I put it in, it's in place, everything's great. Okay, I went for a walk and now I feel it, it's sitting low, like it's going to come out. So I'm not sure exactly what's going on with you with that, but I will say that in general, when I've had clients have these issues, whether it's a tampon or a cup, working on opening up the hips, working on learning how to lengthen the pelvic floor with movement. So we move in specific ways that can help open the area. All of that helps build the support we need for the cup to be in a good place. But oftentimes it's maybe more of a tension thing, the cup feeling weird. But also, not to give too much information, it's very normal for you to feel like you need to use a different trajectory or like angle to get a tampon or cup in comfortably after you have a baby, no matter how you deliver. That is very normal. But if you have to use a different angle, then it should stay in and you shouldn't feel it. So just know all those things are normal, but then at the end of the day, it should be staying in place.
So question on exercise, food choices, anything like that acting how your body works together with the floor.
Exercise and food choices?
Yes.
And the pelvic floor. Okay, so let's do easy one, low-hanging fruit, or food choices. It really depends on you. Some people find that certain foods or certain drinks will irritate their pelvic floor, meaning that it makes their urine a little more concentrated or a little more acidic, so it might be harder for them to hold, or they have more issues with leaking. The big culprits there are diet sodas, coffee, tea, iced tea, sometimes anything with artificial sweetener. So even like the seltzer some of us love that have a little fake sugar, that can be a culprit. So, and from a food perspective, like if you eat something that makes you more gassy and you have kind of more going on down there, that could make it harder for you to be continent with gas or with urine. But as a whole, we think more about the drinks, but it's very, very person dependent. And then exercise and the pelvic floor. This is a huge topic. Trying to think about how I can say this simply. So bottom line is yes, the way we move, the way we exercise will impact our pelvic floor. So right off the bat, if you're doing things like running and jumping and you're leaking when you do those things, that's a sign that you're not coordinating well. So just, boop, that should go off. If we are moving our body in a way that helps support our hip muscles, strengthen our hip muscles, support and strengthen our core, all those things are going to help our pelvic floor work more efficiently and not have to, that means the pelvic floor can do more of the job they need to do, which is continence and a little bit of stability. And then we've got the hip and the back and the core providing more stability, which is what we want. I hope that answered the question.
No, I just want to give people an idea of like what to look for. So I have another question. People are asking some amazing questions. I'm 6 weeks postpartum C-section. I've been experiencing a lot of hip and I don't know what that is, joint pain. I also noticed I squeeze my glutes tightly together when standing. Could this be tied to a weak pelvic floor?
So this is a terrific question. So for anyone that doesn't know, SI joint pain, let's see if I can kind of show my body here, is usually right here.
Oh.
It feels like it's almost on the glute, but it's more on bone.
Yes.
SI joint issues, hip issues, so common after any kind of delivery. So again, if you were to come see me, my first, the first thing I would actually be looking at is how do you move your body and how is your strength? Your pelvic floor would not be the first thing we looked at because it sounds to me that this is more of an issue with maybe mobility in the hip joints, strength in the core, which remember our core is going to provide some stability because the core attaches to our pelvis. How is this tug of war kind of happening between the two pelvic bones and the sacrum, right? What's this tug of war that's happening that's causing your pain? And oftentimes this is linked to weakness. So something's not showing up like it should. Maybe it's the glutes, right? Because you are clenching all day, which is your body telling you, I need more stability. I need it from somewhere. So we clench. So it could be glutes, it could be core, it could be hamstrings, it could be a little bit of everything. So our job would be to analyze how do you do basic movements that you do every day, sit to stand out of a chair, pick something up off the ground, a few other things, and then how can we change those movements and build strength so your pelvis has more stability. Your pelvic floor would likely be involved, but doubtful that that is like the answer.
So it sounds like you do more holistic than just the pelvic floor. Am I hearing that correctly?
Yes. So that we see a fair amount of clients that have been somewhere else before, and they've just been given Kegels or just stretch your pelvic floor. We are really looking at your whole body from head to toe, like what's your jaw doing down to what are your toes doing, and how's your whole body functioning together, and how is that function impacting the pelvic floor? Remembering that our bodies don't want us to fail. Our body's going to do whatever it can so you can do what you need to. So that might mean that certain muscles start showing up and working harder than they need to. So for instance, if your hips are very weak after having a baby, which is very common, well, your pelvis needs stability. So where's the stability going to come from? Your pelvic floor. So your pelvic floor starts to grip and get tight. You start to have all these pelvic floor issues when the issue is actually that you're not stable from the outside. It's like a basic way to put it, but yes, very important to look at the whole body. We don't just blame the pelvic floor for anything. It's for everything. It's it's a supportive structure.
Do you also help with people? We mentioned like the foods. Do you do the foods? Do you have nutrition plans that would come with it, or things that you would recommend based on what is telling you that they are eating and drinking? Do you have like, as far as your services, does it also come? Not like not a. I mean, am I wrong?
Yeah.
But do you talk about foods and things that would impact and included with it?
Yes, I will. So on a very basic level, so when someone's having a lot of issues with urinary incontinence or leaking pee, that's when we're kind of taking a deeper dive into what are you drinking and eating. If some of the things we typically do to solve that problem are not being solved. And then sometimes we'll recommend supplements if someone's having a lot of gut issues with constipation. We'll try to help them get on the right track to get things moving. But I'd say that's on a very basic level, like as basic as what I just told you.
Got it. So someone just asked, which I had a question for as well. What does a typical pelvic floor PT session consist of? But I want to tack onto that with my question as well of how long does a typical, because I feel like we're pumping. People want to just come one time and be like, that's it, I'm done, right? So on top of like, what does the session consist of? On average, of course, that is on average, what does a typical person need in a session? Like typical, give me, just, I know more than once, you know what I'm saying? It
Okay.
could be a year, but like on average, what do your services consist of? And like, how long does a typical person work with you?
Okay. So there's a lot to unpack here. So first, let's just talk about how often someone sees us, length of sessions, and then we'll get into what to expect in a session. So as a whole, on average, our clients see us anywhere from like 6 to 8 times. Now that typically doesn't look like they're just coming to see us once a week for 8 weeks. Usually at the start, we like to visit about once a week for about 4 weeks. Then after that, we would anticipate that your symptoms are starting to change and that we've kind of figured out the crux of the problem and we're going to start really going after it. So we say 4 visits to start to see a change. Some people are better by then and some aren't. And then we start to spread out visits every other week and we'll see them a couple more times. I have some clients that want to get back to really high level activities. They want to be running 5Ks. They want to be rock climbing. They want to be doing CrossFit. Those are the clients that oftentimes will stick around longer, and maybe we start to see them once a month to make sure that they're slowly meeting their goals. So like I said, around an average of 6 to 8 times. Every session is 1 hour long, and we really do tailor the treatment plan to the person. Like sometimes I get people that are just like, I need to get better as fast as possible. I want to see you every single week until I'm better, and then that's it. Terrific. Other times I see people that are like, I don't have a huge time commitment right now, but I know I have to be moving things forward. I can come once every 3 weeks. Great. We always work with people, like I know you do, where they're at to make sure the most important thing is that they get better on their timeline. Then a typical treatment session, and again, remembering that we do virtual and in person. So if you see us in person, we will do an internal pelvic floor exam. So it's different than like when you go to the doctor. We're doing a muscle assessment. We're not looking at your organs or anything like that. It's a very simple, I'd say minimally invasive assessment that can take anywhere from 3 minutes to 10 minutes. We're basically using a gloved hand to feel the walls of the vagina, feel the muscles, to tell us what's happening. Do they feel weak? Do they feel tight? Are you coordinating well from a basic level of breathing, kegeling, bearing down? And that's to give us information like a piece to the puzzle. Now, when we see somebody virtually, we can't do that. So this is where we're really looking at how does your body move, which we're also doing in our in-person sessions too. So most people, we will look at, if I tell you to squat, what do you do? I don't care if you don't exercise. This is going to tell me the choices your body is making. That helps us identify where you're tight. So I'll say, let me see you squat. Let me see where they are in space. How do you contract your stomach muscles? How do you breathe? We're looking at these basic foundational movements and activities to start to tell us what's happening with your body. And then anybody we see virtually, based on their symptoms and getting your questions answered, there's so many tools out there right now that we can recommend for you to do a little pelvic floor work on your own, if that's warranted. I hope that answered your question, but we kind of take a whole look. How does the whole body move? How does it impact your symptoms? And then we just kind of narrow everything down. But we have a very strong strength approach, building strength in the body. It doesn't mean I'm going to have you like, you don't have to, I'm not going to make you lift a ton of weights, but you have to build a little strength.
I love it. Someone just asked, end of second trimester and having some small urination leakage when cough or sneeze. Is this normal? Anything that can be done? Does this mean I have a tight or weak pelvic floor?
I love it. So you know my answer is going to be, it means you have a coordination problem. Okay, so I will say, unfortunately, this is very normal, but you can make this better. I've literally seen clients in their 3rd trimester that had issues with leaking and were able to stop their leaking before they had a baby. So again, what happens is your stomach's growing, that nice pressure system we talked about, everything opening and then contracting and closing and supporting is getting mismatched because of the baby's growth. It's your job to keep your body coordinated. It will not come to you second nature because your body's fighting against you as you grow your baby. So some simple things I like to do are a hand on the low belly or a hand monitoring at the perineum. You'll breathe in and you'll breathe out like you're blowing out birthday candles, or put a straw in your mouth. Blow out through the straw. And what happens? Do you feel your lower stomach or the perineum area push into your hand and the bulge, or do you feel it come in and tighten? What we want is pelvic floor comes in, belly comes in. And this might mean if you're pregnant that you have to actually think, I'm blowing out through a straw or I'm blowing out candles and I'm pulling my stomach in on purpose. You have to actually think about it. Practice some of that. Hum in the car. Make sure your stomach's coming in. That's going to start to build this coordination of a forceful exhale, everything's supported. So bottom line, it can be improved, and it's probably coordination. It's unlikely that it's weakness or strength.
Love it. So in between the hour session, if that's weak, and then do you give things in between the week for people to work on?
Yes, so we're always giving what we call a home program, and that looks different for everybody. Again, we really pride ourselves on looking at the individual client. We're always asking, like I ask every time, what's your time commitment like? Could you do 5 minutes a day? Could you do 15 minutes 3 times a day? Like finding out kind of where they're at. If somebody's already exercising, I love that, because what we can do is make little tweaks to what they're already doing to help them meet their goals. If they're not exercising at all, they might be like, this is so overwhelming. Give me like 2 things that I can do while I sit at my desk at work. Great, we can do that too. So we really meet people where they're at, and our programs look so vastly different because everybody's situations are so different.
And I love that about you. And I want to say, Dr. Ellen, how many kids do you have?
I have 2.
So she's a mom like us, like where, sometimes like, because you hear that importance of how much time do you really have? That becomes a big factor in who you work with when it comes to stuff like this, because having a time commitment that you actually can make feasible, that you get a plan and may not be able to keep up with it. If you're honest with people, listen, I do this a day. I think it's great to work with someone that understands that time commitment, not just professionally, but also personally. Being a mom herself, of having 2 little ones, I think it is so, so, so very important. So I just wanted to let you know, like when I work with people, that I bring people on, I am from a place of, they got to get this. Like when I see coaches that are like, we're going to do this for an hour every day, and, and then we're going to do this, and then we're going to do that, and then it's, morning and night, and that. Yeah. You could just, we're not going to keep up with it. Working with someone that's realistic. Please know, I want us to ourselves. This is so important. Like I said, I'm noticing all these things that could be better with me, and I this month alone to prioritize what is important to you and for you for your journey in your life. So as if you have a physical job in exercising but not coordinating well, stop exercising and just focus on coordinating.
No, so I think I sort of know what you're asking, and if not, whoever typed that in, just clarify if I don't answer your question. So it's another thing is I typically don't like to take people off of what they're doing. So even if their coordination is like awful, which we see, and all backwards, I'm not going to tell you, you can't do anything until you coordinate well, because it's not real life. Think about it. You probably have kids. You're lifting laundry baskets, you're lifting your kids, you're carrying groceries, you're vacuuming. I mean, you're doing all these physical things every day. So it's important to keep your body strong. So I'm all about keep up with whatever activity you're doing. We're gonna make tweaks along the way. And it's okay if things aren't perfect. If your form isn't perfect, if your coordination isn't perfect, we'll get there. So we kind of do things all at the same time. I'm not, it's not like you're gonna come see me and if your coordination's bad, I'm like, okay, all you can do is breathe and do your pelvic floor work from now until December. Like, no, you'll get active things to do as well. And yeah, so I hope that answered that person's question. If not, whoever that is, write something else there.
I'm gonna give 30 seconds to a minute. You all can type in if you have any follow-up, Dr. Ali. So I have a question on working with your team. How does someone sign up to work with you? Where do they find you? What's the best way to get in contact? Just give us the details.
Great. So obviously you guys can follow me on Instagram after this. That's where I post a lot of I post a lot of content. I have a link in my bio. You click that, it'll take you right to our contact page. It's very simple. You basically fill out your name, your phone number, your email, what you're struggling with. And then my administrator, Angela, gets those inquiries and will respond back to you and answer any questions you have. Send questions to me if you have specific questions for me, and then help get you scheduled. That's like the most basic. I sometimes have people just DM me and say, hey, I want to book. And you can do that too if that's what's easier for you. I might pass you off to Angela, but that's okay. But that's the easiest way, either DM me or contact through our website. And then you get what we have, like I said, myself, Casey, and Rachel. Right now, Rachel does only virtual visits. She has really great availability and flexibility. So anyway, we just kind of match you with somebody really based on your needs. So if you're local to New Jersey and you want to be seen in the office, you'll see me or Casey. If you want to be seen virtually, you can see any of us. And it really, like I said, depends on the person's schedule. But we do have hours Monday through Friday, occasional Saturdays. We have evening hours in the office and virtually. So we really try hard to, meet the needs of moms in those situations.
Someone asked, how important are MRIs or imaging / ultrasounds to figuring out types of
prolapse? Okay, great question. So that was what you said, right? Prolapse?
Yes.
So I will say imaging for prolapse is not a top concern. I would say not necessarily widely done unless maybe you're thinking you're a surgical candidate. So a surgical candidate for prolapse is someone that has like a descent of the vaginal wall that's through the vaginal opening all the time. Most moms that we see and work with have a prolapse or descent that comes and goes. Sometimes it feels worse, maybe after being on their feet. Sometimes they don't feel it at all. Maybe when they first wake up in the morning. These are great candidates for seeing a pelvic floor PT to help get this better. Again, I know the word of the day is coordination. The top thing we do when somebody has prolapse is to work on their coordination and manage their symptoms. So to loop back to your question, and I don't know how old you are, how many kids you have, or anything like that, but most of the women that we see, they're anywhere from 0 to 7 years postpartum. They have this heaviness that will sometimes come and go. Do we care where it's coming from? Yes. Is it your uterus? Is it more of like your colon? Is it your cervix? With an internal assessment, we can gather that information. But it's controversial to say this. Usually, I don't really care. At the end of the day, what do we care about? We care about your symptoms. So if you have heaviness when you walk more than 15 minutes, that's what I care about. What do we have to do to get you to walk more than 15 minutes without symptoms? I don't really care that it's coming from your cervix because you're symptom free. That's like, I know it sounds very like, whatever, but at the end of the day, that's what matters, right? It's distressing to feel that heaviness. It's distressing to feel like once in a while you reach down and you're like, oh, there's like a bulge there that wasn't there this morning. Very distressing. Our job is manage the symptoms, find your aggravating factors, and then improve them. It's my favorite. Treating prolapse is like my absolute favorite. And usually people are very, very surprised on how we go about that. So hopefully I answered your question. I don't think imaging is necessary. I think when we're in pelvic floor PT, they should be focused on your symptoms and not necessarily like we'll grade it sometimes. How bad is it? We don't, again, I don't really care. I just want you to get better. I hope that answers that question.
Perfect. Someone asked, and I'm going to have a follow-up, but I'm going to let you answer this first. If I can't get Dr. Allie, but want to have PT for my pelvic floor, what are some questions I should ask?
Oh, that's great. So top things when you're calling a clinic or trying to see somebody, you want to say, how long do I spend with a therapist one-on-one? If they say anything less than 30 minutes, probably don't go there. Because again, the pelvic PT is the one that's going to have the unique knowledge of the pelvic floor. It can be difficult because not every pelvic floor PT is going to look at the entire body. They just won't. Some people only focus on like, what is the vagina doing? That's all they focus on. They don't have the whole picture. But so it's one question is how long will they be spending with me one-on-one time? Can this therapist do internal assessments? You'd be surprised if people will call themselves a pelvic floor PT and they can't do an internal assessment, which is why, at least for our virtual stuff, we call it coaching. We know we can't do the internal stuff, but we've got the knowledge you need. but you want to make sure you're seeing someone in person, that they're cleared to do that. You can also ask, does this therapist have experience getting women with these issues back to running, or whatever it is that you're trying to get back to? Because sometimes there is this gap, like I said, where they can get you to stop leaking, but anything beyond that, jumping, running, they might have a hard time with. So you just want to ask some of those questions. Getting a bio from the therapist can be good. A lot of times, kind of clinical call, maybe you can't talk to them directly, but trying to find out their background. Those are good places to start. And again, if you feel like you're seeing somebody for 3 to 4 weeks and nothing is changing, that is a sign that something different needs to be done. This therapist might not be the person for you.
Someone just said, do you perform internal stretching of pelvic floor pre-birth to reduce tearing? What does that,
Sure.
does this?
So yes, so this is a concept that we will review if we see you virtually, and if we see you in the office and you want to, we can do internal stretching for the pelvic floor leading up to birth. Some clients opt not to, they opt to do it themselves. We know, science has shown us that if we're doing some stretching to the, we call it the back wall of the pelvic floor, so the area that tends to tear between the vagina and the butt, if we're stretching that gently from 32 weeks to delivery, we can reduce the chance of a severe tear. And this is where we want to be really clear for anyone that hasn't had a vaginal birth. We grade the tears from the doctor will grade the tear from 1 to 4. A first and second degree tear is more of that superficial kind of tear. That's what, if you tear, that's what you want, okay? The stretching we're gonna do leading up to birth is to prevent a grade 3 and 4 tear, which is the tears that actually go up into the pelvic floor, sometimes into the butt. We don't want that. So the way stretching looks like is you'd be in a comfortable reclined position, we use our finger, or if you're at home, you'd use a special tool, stick it just inside the vagina and apply very gentle stretching paired with breathing to help those muscles learn how to lengthen. We're not like pushing real hard, we're not stretching them out too much. We're teaching the muscles, this is what it feels like to lengthen.
So I'm going to say this because this came up on my side this morning. I'm going to address this and Dr. address it as well. There is a huge understanding that should take place to help move this community forward and right? Some people think that you can only get certain care in person, right? And the one thing that COVID has taught, the one thing that being a mom has taught me is I don't have to leave my house for too much. Even depending on what it is, I can do virtual telehealth sessions with my kid's doctor if I needed to, you know, depending on I gotta go in, you know, I gotta go in. So I want to have it's definitely, if you are more of a person that you want in person, great. But I think that working with someone that has a proven track record of seeing people virtually, you have 2 other people on your staff able to accommodate virtual, you can live anywhere you want and not have to leave your house. Because it becomes, if you work with someone for 8, 6, 8, 9, 12 weeks, that man has that time to get there. Time to sit in a waiting room and wait and hope that you're going to be next. Time to get back home. So can you just talk about, you know, just in general, your success virtually?
Sure.
Someone wants to, but I definitely just want to have you talk about just the virtual success as well.
Sure. Yeah, so I did start my business right in March of 2020, completely virtual. My initial thought was just to help some really friends of friends that were having babies and having some issues. And they could, you know, oh my gosh, they weren't going to leave the house alone, bring their new baby to an appointment. So they reached out to me, and that's where we started. And I have to be honest, it even surprised me how well it worked. It works because we focus, so myself and other therapists, we focus on how your body is moving and how that movement, how your habits, how your breath, how your coordination with your core, how all of that plays a role with the pelvic floor. I have seen some clients virtually in other states that have seen therapists in person, not gotten better, and then seen us and get better, because again, we are taking that step back and looking at the entire body. Also interesting that we have such a great success rate with our virtual clients, I think, is because there's so much autonomy needed to see somebody virtually. You need to be a little bit more motivated. You have to be willing to maybe learn some release techniques, not even on your pelvic floor. Maybe we're doing release over the ribs, whatever. Learn some of these techniques, do them on yourself. It really, we're like your guide. You don't, our job when we see virtually is you should never rely on us. We're guiding you to heal your own body. And that is why I think these clients do so well, because they have to take the responsibility, but then they see the results they get and they're like, oh my God, I did that. Or, oh my gosh, like one of my clients I see virtually, before she started seeing me, she would get sciatica. Like she saw me for postpartum stuff. On top of that, history of sciatica, getting these bad flares every couple months for years. Since she started seeing me over a year ago, we just meet about once a month now, but since she started seeing me, she has not had any flares that have lasted more than one day. And that's because she knows, oh, I have the symptom, Allie showed me what to do, I have autonomy, I get myself out of pain. She's not calling me up crying like, oh my God, Allie, I have to see you. I have to see you right now. I don't care if you're on vacation. I can't survive. And that's what it's about. We teach you how to heal yourself and your own body. And it's been the coolest journey. It really has.
I just had to put that out there because, you know, I only see people virtually for pumping, and someone was questioning me about, I was like, I don't need to see you, because if I teach you for yourself how to do something, then you don't need me. Like, you know, the perfect time, you do everything perfect while you're there, and then you leave and try to go do it or replicate or anything. You're not able to do it. And I just think that it's the same way. And when you find someone that's so focused on you and that's not always, if that makes sense. Yeah. So another question, and then I'm gonna let you go. Why didn't my OB talk to me about my pelvic floor? Why is this not talked about?
Oh, that is the question of the year, isn't it? So we have to remember that the doctors that are delivering our babies, I know it sounds bad, it's really not their job. Their job is, are you healthy? And is the baby healthy? That's it. They learn how to deliver babies and care for your organs or reproductive structures. They're not sitting there learning this muscle externally rotates the hip. Like, that's just not something that's important for how they're going to treat you, which is where we come in. And luckily, with my practice, we work very closely with the OBGYN group here locally. So we can really bounce ideas off each other, and they learn from me and I learn from them. But unfortunately, that's right, the one hand. And on the other hand, not all doctors right now are all on board with the idea of pelvic floor PT. They think, do Kegels, you'll be okay. But as we're all learning, and you guys are learning today, it's about so much more than that. The biggest thing you can do is just be an advocate for yourself. If you choose to see a pelvic PT, if you've seen somebody and you've had success, tell your doctor, hey, remember when I was struggling with X, Y, or Z? Well, I saw Allie at Essentials PT. Here's her card. I got so much better. You should recommend this. It's one thing for us to talk to the doctors, but when they hear it from you that it helped you, that's what changes trajectory for women as a whole. And I just think that's so important.
Because I literally had a client who was like raving about me to a pediatric unit here, and like one of the hugest practices in Northern Virginia is asking for my card. And I'm like, I would just walk in and be like, here's,
yes,
you know, you have actual clients that are promoting it. So the last question is, will health insurance cover pelvic floor PT?
Okay, great question. Of course, the answer is it depends. So if you see an in-network pelvic PT provider, they tend to be out of like hospital-based clinics, then your insurance may cover it if you have PT coverage, right? We code in the same way as going to PT for your knee, right? So there's no reason that should be denied. My practice, many other practices are what we call out-of-network practices. If you have out-of-network benefits, your insurance may reimburse you for those visits. If you have health savings, flex spending, you can use those to cover your visits as well. Some of the perks, I guess, some of the perks of seeing somebody out-of-network is we have like no wait time. You come in, we see you at your time, you leave at your time. Usually, at least right now, we're not on a wait list for new clients. Some of the in-network clinics by me, I mean, they're on 6-month waiting lists, and then you can only go 5 times, right? So we're going to see you as much or as little as you need, and everything we do is about you. Remembering that when you use your insurance for a service, which is fine, we all have and need insurance, right? When you use your insurance for a service, they are the ones that dictate your care. They are the ones that are saying you can have this many visits, you can code this, you can bill this. When you see out of network, what the insurance company says, a bunch of people sitting behind a computer, that doesn't matter. What matters is us, the expert. What do we feel you need to get better? And we're going to provide it to you as much or as little as you need. So as a whole, your time may be less. And again, I've given examples. I have had clients that have seen people in person and they're told to go like 3 times a week. They're 3 times a week for whatever this problem is, and they're still not better. What a waste of time and resources. PTO, things like that. We the way we do things, we find is very helpful and supportive for moms, stay-at-home moms, and working moms.
And you say this as well, like, but you could go somewhere for 3 months and spend all the co-pays, or get straight to the point. Yes. And get it, you know. But anyway, that's my soapbox for the day. I know you feel, and I know I'm also guessing you can give super bills as well, right?
Yes. Yep.
So if you don't know, that's for insurance reimbursements. Always get a super bill after a visit to be able to do so. And then this is okay. That's a question for me. So that's all. I know I've kept you long enough. Allie. Dr. Allie, her team, Essentials PT, send them a DM if you have any questions. This was an amazing live. It will be saved on my page. Instagram is cooperating. I always throw that disclaimer. It will be saved permanently on my page. Thank you all for joining. I just if you don't realize, I bring people to you that I believe in, that we align really, really well, that it's about doing what's best for you. You heard that in so many different ways. From everyone that I talk to, we're about trying to find things and ways that works best for you in your journey on where you stand in your lifestyle. So I hope that you felt that. I hope that you know that I wouldn't bring anyone to you that I didn't believe in. That I prioritize and focus your journey on what you need. If you're seeing signs, get the help. Like, don't wait and wait and wait, and then it doesn't get any better. That's what's happening with me. I barely when it's time on, and my body is in a state, in a condition that I need to focus. And I waited 5 years for my first child instead of tackling it a long time ago and really focus, even learning a tool that you can help stretch your pelvic floor, or the things that was stated. It's just like, we don't know. We can't always depend on give us the answers that we deserve, because we'll be waiting forever. And it's something that when you're tied into true life's work that aligns with your goals, what you want for yourself, you sometimes don't get into the insurance stuff all the time. Ties your hand with a lot of things. So in every single way, reach out to Allie and her team just to figure out what's best for you. Like, what does care need to look like? If you find page, she's her stories every single day like me. Like, people really go to the doctor and they realize, or go to another professional, and like literally they don't even get asked half the things that they're asked, and they're like, well, I know this is what I'm supposed to be asked because I'm watching Allie and her team talk to me, and this, and I go and they'll ask me anything. They just say, get legal, bye.
Yeah.
You haven't gotten care. And I can sense that in just talking to her. I watch her stories, and that's what was a part of me identifying that I have something going on. Like, I bring people to you that I need us to get holistically better, because when we do have to run around and behind our kids when they start to get older, my oldest is starting to turn 5. I can't keep up with him sometimes. He's like, Mommy, let's race. I'm like, okay, let's go. Like, it's the things that I didn't value at first. And I don't want you to repeat the same cycle that I did. If I can save 5 people from going through what I'm going through right now, that I barely can walk when my cycle's about to come on, and I go to the doctor and they just tell me, we can't help you right now because you're not sure. I'm like, what are you talking about? I have to go take matters in my own hands and pay out of pocket to work with people that align with my goals. So I just really hope that you take that in the love that I'm trying to give it to you. And please don't do what I did, because it ends up just doubling back. And I'm 5 years in, and it's not getting worse. So take my soapbox moment. Know that I appreciate having you here today. Thank you to you and your team. Anyone still, please follow the Essentials PT. Reach out to them if you have questions, concerns. Like, they can at least, like, hey, yes, we help with, like, you know,
Yes.
it was different, but yes, we help with this. Hearing that with the confidence that they actually can help you is so much more than just spinning your wheels in so much pain trying to keep up with your 5-year-old. Please don't do what I hear nothing else from me from this conversation. So back to your day. Thank you so much. You have anything else you want to add?
No, I just want to say thank you very much, Dr. Diana, for having me on, and everybody that joined in and asked excellent, excellent questions. Share this with a friend that might be early postpartum or just about to have a baby so they can learn a little bit. And just know that, like, DMing me or filling out a contact form on my website does not mean we're like going to harass you to death to book a visit. Just if you have a question, reach out and ask. I'm always in my DMs, sending voice memos and things like that. At the end of the day, our number one goal is just to help women feel their best and not be stuck in this place postpartum where they're feeling like absolute bad work. Shit, okay? We want you to feel great, and we want you to feel confident, and we don't want you to be limited by pain or pelvic floor issues. We're here for you. And just thanks so much, everybody, for joining in, and it was a pleasure. Thank you.
Have a wonderful, wonderful day. See
Thank
you soon.
Bye.